We're back. Strength and knowledge is back. I'm John Allan, and in this episode, Dr. Alex Hubelbank and I discuss physical therapy's role in professional sports. Specifically, we dive into the gaps that still exist at this level, the importance of training resilience in the offseason, and all factors that could lead to poor performance on testing day. Without further ado, let's get into it. Dr. Alex Hubelbank, a physical therapist and trainer for basketball players at the professional level, as well as a stud in the weight room herself. Your passion for pushing the needle toward the highest quality of care is very evident. For those who are unfamiliar with you and your passion, please introduce yourself and tell us where this passion for high performance comes from.
Mm. John, thank you so much for having me. Obviously, I spent some time at R2P myself, so it's nice to hear back from the homeland. Um, yeah, I mean, I went to school for athletic training at Boston University. I took a little bit of a winding path, ended up in the tech world with Apple for a couple of years, and then found my way back to training, became a strength coach for professional rugby and on the private side at Flight Performance. And then ultimately, which was always kind of my dream, to go to PT school. And then from there, kind of went into the NBA and have found myself on the private side of professional sports mostly since then. But I think I intentionally took the route of going between athletic training, strength and conditioning, and physical therapy to really appreciate the overall process of what it takes to be at the highest level, not just in my own practitioner's brain, but also as an athlete and understanding the priorities of each of the professions and each of the components of what it takes to be able to actually play sports and be involved in sports at the highest level.
Yeah, perfect. That transitions nicely right into our first point that we were kind of talking about is like the PT's role and the athletic trainer's role in professional sports, right? There's been a shift to kind of like a collaborative mindset of like some of the best sports medicine staff. Like it's no longer separate between treatment and performance. There's no true like cutoff between a handoff between, hey, PT's done with, now you're into the sports coach or strength coach. So kind of let's just talk about like your experience with like the PT's roles evolution within professional sports and you can go any way with it and then we'll dive into it.
Yeah, that is a great question and certainly taps into, I feel like, my number one passion, which is process engineering and delivery of care across the healthcare continuum. So ever since I was pretty young. I mean, my interests were in getting into professional sports, but I thought that was because professional sports are where you have so many resources that are involved in caring for your patients. And I felt like on the, I'll call it the private side, but in the clinic or in a sports arena that isn't professional at that time when I was coming up, there wasn't a lot of synergy between those. So if you were a regular person like myself at that time, I was a soccer player and you have an ACL injury, you go to your physical therapy clinic, which at the time there weren't really even cash pay options. Or if there were, they were very limited. And then you would maybe go to some place for sports performance, but they really didn't have communication. And then you might go back to the athletic trainer at your team if you even had one. And it was this very fragmented experience. So, to answer your question, I'm seeing a lot of change even in the past 5 years, but also the past 10 years of how not only are physical therapists becoming more prevalent in professional sports, but having those dual credentials are becoming essential. And a lot of it has to do with, yes, you still do have a handoff. So you have a delineation between the strength and conditioning coach and the physical therapist, but that's based on role, not necessarily always based on skill set, particularly in basketball. And I can speak somewhat to other sports, but basketball has definitely evolved to have a lot more physical therapists than I think a lot of other professional sports have. But it's also variable team to team. Some have two, some have five, some have one. But there are also athletic trainers whose role and responsibility is a little more on the acute side. And then even some of the strength and conditioning coaches that you find in the NBA are dual credentialed as physical therapists, or vice versa. The physical therapists primarily spent time as strength and conditioning coaches. I would say that probably the reason for that has a lot to do with resource allocation, but also player preferences. When a player, feels comfortable working with someone, it's a lot easier to transition them through their care plan with one individual than a true delineation of handoff. And the communication makes more sense that way. So you have a hierarchy of how information gets delivered, and you have so many people involved in moving an athlete through their situation, especially in a long-term rehab.
Yeah, perfect. Yeah, those long-term rehabs definitely get dicey, especially in the more high school level. But once you get to professional sports, I would assume there's be a more consistent and continuum of care for like load management, movement qualities, return to competition timelines, and all that stuff. So, are there any
And
gaps that you still
yeah, sorry.
believe exist?
Yeah, I mean, I was going to say that one of the biggest changes that probably is starting to try and address those gaps is historically, and I think you can understand that regardless of where you work, there was this, okay, you do physical therapy or you do your acute care, then you do physical therapy, then you do strength and conditioning, where at the professional sport level, which probably the number one variable that is different is time, where everything is constrained on time. Obviously, you want to get an athlete back as fast as possible. You want to get an athlete to be able to play in the next game. There's season upon season, there's contract negotiations where I think people started to realize that layering them on and having it be a parallel process affords us a better time allocation than waiting for one to transition to the other. And certainly from an educational level, going through PT school, you're when it comes to like the strength and conditioning, athletic training, et cetera, physical therapists are the most primed from an educational level to work with people for the longest period of time in that way. Maybe strength and conditioning a little bit, but again, it's block by block, where physical therapy, you can have people that work with you for a really long time, even from a maintenance perspective, in how variable day to day, week to week, depending on what they're carrying, whether it's a specific injury, like let's say an ACL or an Achilles or something like that, or it's more general and something that comes and goes based on how many games they played, how many minutes, to your point, load management, whether they're in season or off season. But I'd say probably one of the gaps across all professional sports is maybe the inconsistency of understanding role delineation. And that's based on how staffs are created. So, like I said, some teams will have two physical therapists, two athletic trainers. Some teams will have more, some teams will have less. And often it's not necessarily based on skill, but it's based on making sure you have the right credentials. But that doesn't always mean that you've thought through how to move these athletes through the process the same way. And sometimes the athletes don't understand the difference of what an athletic trainer does versus a physical therapist. So they might have a preconceived notion about what one or the other does, and that might dictate their comfort level or not with that particular individual.
Yeah, I feel like even at that highest level, you have to sell yourself, whether it's the physical therapist, the strength coach, you have to still sell yourself, especially on the private side, right? You have to build that connection. You have to sell yourself that you belong in the building with this professional athlete. You are have their best interest. You're not trying to keep them out of the games. You're trying to get them as strong as possible, perform at the highest level. And again, I feel like it's just really cool to kind of hear your perspective on the professional level and how it's still a challenge at the professional level, even at the level outpatient level, like we're at in every episode performer. You have to sell yourself. You have to prove to the patient every day that they belong, that they're getting the best care, they're in good hands, and then that's how you continue to get the best outcome. So I appreciate you making that point. There's a lot of ways I want to go with this, but I think the next point I want to talk about is like the off season. You talked about how you're with a lot of these athletes for a long time. A lot of times it's in the season, but it also transitions throughout the off season as well. And can you just talk about like your mindset when you do have a little bit more time on your hands with the off season? What are your top priorities? And obviously at the professional level, sports specific stuff typically happens like they're already at the highest level of their sport, but it's still important. But like kind of what are your top buckets and priorities for those off-season sessions with these athletes?
This is definitely probably a variable per sport. So I'll talk about it through the lens of basketball because that's probably the sport that I've spent the most time with now. I would say probably have a few, but one big one, getting them to stay off the court for as long as possible. And what I mean by that, and it's certainly dependent on where they are in their contract. So what is their lowest hanging fruit? So if they have to be on the court because the area that they need to improve in is basketball, then that's a negotiation. And that looks like, what version of basketball do you need to be involved in? Does that mean individual court sessions or does that mean playing? My argument would always be against playing for as long as possible if we can, but I also understand this is their job, and that's an important component. So that's one piece. The other piece, or another piece, is GPP. So for how long can I get them to do general prep that explores more movement variability? It gets them to, I even talk about like learning a physical skill that's as far away from basketball as possible. So I've encouraged some of my athletes to do hand fighting. So we hire a jujitsu practitioner or someone who can teach them hand fighting within a controlled environment, dance lessons, um, anything that gets them involved in a movement skill that isn't the same movement skill that they already do, and mitigating risk within that. So that's one piece. GPP, staying off the court for as long as possible, but that doesn't mean don't touch a basketball. That means don't touch a basketball live. And if you are going to do that, let's explore other ways of training that are not just that. It could be even yoga. It could be Pilates if you're interested in that. But I need you to do a bunch of things that aren't the same that you've been doing for 7 months every single day. I would call that. It also depends on where they end the season. So if you go deep into the playoffs, your season might not end until June. So that changes the window of time that you have and what that actually looks like. And I've just recently had a conversation with an athlete who is continuing to play right now. And so our conversation about how long he should take off when the season ends is going to be very different than a team that was done April 12th. So month one, month two, looking at, again, what are your lowest hanging fruit? So if you go back and look at all of their outcomes from the previous season, and if they historically had an injury, let's take some of that stuff and make it into a strength. So if it was a soft tissue injury, then obviously we know where we need to start. Let's call it a hamstring. We need to obviously look at their outputs and their capacity within the actual individual tissue, and then at the global level. Let's make sure they're involved in things that bulletproof that area or take that from a weakness or something that caused them to miss time the previous year into a strength. Take their goals into consideration. So a lot of athletes will know, okay, my second jump is not strong enough. Okay, great. Well, you've already told me something that's salient to you. I'm going to make sure we tap into that. But then you ask their coaches, or you ask them, is my favorite question, what do you think is a weakness? And then I ask, what do other people, what would they say your weaknesses are? And if there's a delta between those, I try and reconcile it, make it important to them. As you said, I'm selling myself, but I'm also making sure that I'm tapping into things that are important to them. But then also, well, let's look at your outcomes. You actually had a high amount of rebounds last season, and none of your coaches would say that that's an area of limitation. They would say that your strength was the problem. Fine. So I might tap into that. That's month two. And then month three and four, if we're calling it a 4 to 5 month off season, is going to be a little bit more quote unquote sports specific. But realistically, basketball can look like basketball and the weight room can look like the weight room. I don't think you necessarily have to bring basketball into the weight room. You just need to bring the elements that are important to your game, which is probably one of the reasons I find NBA the most fascinating, is because there's so much variability in an athlete's game, even at the same position.
I'm glad you brought up capacity because I feel like at any level, any sport, that's something that people are a lot of times leaving out. They just would rather just play their sport. They would rather just do the bare minimum strength training, bare minimum conditioning, endurance, things like that. But truly building that like capacity, building that full picture kind of, I love the point about the like the dance lessons, hand fighting, that kind of stuff. Like that's such a great example of just like providing like that neuro relief of the repetitiveness of the basketball season. Like at the professional level,
Yeah.
they do so much basketball, and just to give their brain a break, a body a break, get those new muscles going in the offseason to build that capacity. So again, another great point that I feel like is cool to see that even at the highest level, it applies there as well.
And I will say it is often sometimes it's a fight of, I will say month one, month two, I don't care about basketball. So like you're gonna be sore, and it's gonna suck when you go try and play basketball, but you're gonna tolerate this, and this is why. And so it is sometimes more challenging than others, but you have a narrow window of opportunity, and that's that first 2 months before you really have to switch gears because you're gonna lose them because they are now oftentimes midsummer, they're engaged in team related activities as well.
Anything else with like energy system work, conditioning, endurance at this level before we get into our third and final point?
I think, what I had said about GPP is king. So I think it's a common misconception to believe that professional athletes are the most quote unquote fit. They are in really specific ways, but if you were to measure their general preparatory outcomes from an energy system perspective, absolutely sure their resting heart rate might be super low. Their ability to run for a long time might be super high or do bike training. But how do we get a little more nuance to say, okay, you need a general base, like go do a 30-minute bike ride as a way of leveling up your general prep. So I have conditioning in the entire summer, but it's just based on what does that actually look like. And we have an internal conditioning test that we'll use to give us an idea of what is our lowest hanging fruit in that area. But that's threaded through the whole thing.
That actually transitions nicely into like the third point about like performing a test battery versus single objective, like obviously hitting on that endurance capacity perspective in conjunction with isokinetic strength tests, like hop tests, all of that kind of stuff. So can you just talk about like kind of how you go through this 4 month time frame and how often are you objectively testing them? How often are you subjectively testing them? And kind of what does that look like in your day to day?
Yeah, I would say I have as I mentioned, a very unique environment where sometimes I'm on the road with athletes. Sometimes we are in less than ideal conditions when it comes to what we have available to us. So I actually try and take whatever I can have on the road with me. So a Tindeck obviously is my best friend. And being able to capture subjective information based on what an individual's pre and post test might be. So if someone has intermittent knee pain, well, what is their test? And then what is my test? So obviously isolated and integrated outputs, movement capabilities. Um, like I said, we have a bike test that we have a VO2 master, so I can actually get VO2 metrics on, as well as we use MERS, so a Moxie unit, which gives us muscle oxygen information. That's a whole other way of objective measuring. But this is something where I'm looking week over week, and I would say I'm probably testing every 4 weeks. But it's also why am I testing? So even though the summer is long and obviously I have a lot more time with the athletes that I work with compared to generally in a clinic or even cash pay environment working with non-athletes. I'm sometimes with an athlete for 3, 4, 5 hours a day. So I do have more resources, but if I'm going to test someone, I often will think to myself, why am I testing them? Am I testing them for me? Am I testing them as a CYA? Or am I testing them because that adds value to their care plan? So I would say 4 weeks as a general, but sometimes we might push that to 6 or even a little bit longer where we are probably not doing a full battery. I might do 10 deck output testing. Even with isokinetic, I don't have one available in my environment. So I would have to take them somewhere, or it might be a way of communicating with the team that they play for if that's appropriate at that time to make sure that we are on track together to get them to where they need to be. And then we have Kaiser equipment. So well, I can basically get a measure almost every week within programming to see their power outputs. I can do general or more specific KPIs for each of my my training buckets to be able to see if they're getting better. And obviously, the weight room's cool because the weight room's an audit. So I'm essentially every time I train an athlete, I'm getting a measure of their status today, but trending over time. Are they improving in the areas that we identified? So I know maybe that was a little bit different than the answer that you were looking for, but the luxury of having both the weight room and the rehab side of things, I think it's giving me a lot of information to check myself and not be biased toward or away from, okay, well, this person's isokinetic looked good, but their single leg hop test was garbage. Well, okay, that's a check on myself. So I'm usually looking at 5 to 6. And then again, the stakes are really high in professional athletics. So I think that alone is telling me that a test battery is probably a good direction to go because it gives me a fail safe on making sure that I've left no stone unturned.
The point that I'm kind of finding myself trying to do a better job of is like be intentional with my testing. I know we have our standardized tests, the tests that are easy and applicable for a lot of patients, but at the end of the day, like, am I testing this for insurance purposes, or am I testing it for the actual best case for the patient? So, um, and again, is this really going to change what we're doing? Am I just checking the box? How often are you kind of looking at like the outside impact, like sleep, hydration, nutrition, things like that on testing day? So if you know you're having a testing day, are you asking any subjective questions that you feel like will that you know will impact the testing results? And does that change your willingness to test on that day?
Absolutely. I'm asking those types of questions. Uh, Again, at the professional level, I have a little bit more insight into that because I'm with these people every day. Not to mention, typically, I'm already managing and monitoring some of that stuff because I'd like to go a little bit more in depth. Because, to the point of the question, if you're going to show up in less than ideal conditions and expect to test, I want to make sure that that's noted, but also I want to consider that. So if you're showing up and you're not well, I don't want to say hydrated because that could happen pretty regularly. But for example, if you've shown up to do a full testing day and you haven't eaten anything, I don't want to waste yours or my time and test. So we should probably pivot to another day. And that's difficult information to capture sometimes because obviously it's like with anything, people aren't necessarily going to want to tell you when they know they've done something that they shouldn't have done. But it's, within the expectation of I want to maximize someone's time, I want to maximize someone's outcomes essentially. So I will change the day if I have to, but I try and make it really imperative that we're always having those conversations. So even when I start working with an athlete, I show them a pie chart of all the variables, quote unquote, that I might consider that goes into creating a positive outcome. And that could be nutrition, that could be basketball behaviors, that could be off court context. So, what challenges does this person have at home or within their life? And that having a child could be a challenge. So, I make sure that we consider things like that, especially, for example, a newborn where you're up all the time or you're dealing with, a baby versus weight room. How much time do they spend in the weight room? What experiences do they have? How is their nutrition? Again, at the professional level, sometimes that conversation is, do you cook for yourself? Do you have a chef? Where do you get most of your meals prepared for you, et cetera? And these questions can be adapted, I think, to any environment, but it helps us uncover what is the best outcome we can hope to achieve. I take that into consideration with my testing and certainly every person, never mind athlete, that I work with.
I appreciate that. I think that us is has a great opportunity for just kind of everyone to apply, not only, especially if you don't work in professional sports, but I think you made a lot of good points that translates nicely to all levels of care. I think treating them like they're human, understanding the full picture gives us insight onto how they're going to perform on any given day on a test battery, even if it's not a testing day, even if it's truly just like a session and they're having a rough night's sleep, they're not eating anything, like that has a huge impact on the session, and you can build a lot of credibility to the patient by being like, hey, like today might be a little bit rougher day. We're still gonna work hard, but it might be a little bit rougher day for either pain levels, either like weakness, whatever it may be. Like just making sure that you are listening to them and not just kind of glancing over that kind of stuff. So, any other points across any of the questions? Do you have anything else, any loose ends you want to tie up here? Any kind of final last words before we wrap up the podcast?
For anyone interested in getting into professional sports, I used to think that it was being able to practice at the highest level. And to an extent, there's definitely thought processes that are extremely high level, but the variables that come into play that oftentimes get in the way of maybe having the most ideal outcome or the complexities around rehabs that should be really simple. I would encourage people to spend as much time as possible not in professional sports before going in because the number of reps that you get, the considerations you have to have really kind of muddy the waters. And so having a really clear process and having like what are the best ways to be able to do this, and having a breadth of that and a body of work that supports that, I think will afford people a better opportunity to step in and really be impactful. So you're not constantly kind of worrying about, is this the best way to do this? What am I supposed to be doing? You already have your process dialed in, and so you step into that environment and you're very well prepared for the potential one injury you might see in a season.
I love it. Thank you very much for your time.